The diagnosis of the causes of lameness. Introduction. Lameness is a symptom, it is not a disease in its own right. It is an alteration in the animal's normal stance and or mode of progression caused by pain or mechanical dysfunction. These facts must be understood before a clinician can begin the process of diagnosis. Terms and diagnoses such as shoulder lameness or back lameness should be avoided as being nonsensical, and every effort made to realize that every lame horse has as the cause of the gait abnormality, a pathological process, either mild, severe, acute, or chronic. Although in a proportion of cases the onset of lameness is coincidental with obvious trauma, the gait abnormality is frequently the first and often the only outward indication of a pathological process within the limb. It is therefore a reliable indicator of pathology. Horses and ponies don't pretend to be lame, nor do they adopt abnormal gaits of their own volition. The animal which is unlevel but not lame is a myth. Another fact which should be realized at the outset is that the gait or stance abnormality is present because to adopt it eases the pain and therefore facilitates progression. And number second, the animal is forced to adopt it because of some mechanical constraints imposed usually by chronic or long-term changes within the limb. We have only to look at ourselves when we limp to realize that these are the purposes of the gait changes which we call lameness. The examination. Record everything in writing. This may seem overly careful, but the first experience of trying to recall in a court of law exactly what happened 2 years previously is a salutary one. And on a less traumatic note, a case record of some detail is invaluable at the end of examination to bring it all together. Although altogether we have noted all these things here, so trying to uh, describe in detail through this writing. And when a case is re-examined months or years later, a shorthand to simplify the task is useful, but only abbreviations which are well understood should be used, as other clinicians may need access to the information contained in the notes. Objectives of the examination. The objectives of examination are: number one, to decide whether the animal is lame. Number two, to determine which leg or legs are affected. Number three, to determine which portion or portions of the leg are affected. Number four, to determine whether a pathological process can be identified, and number 5, to assess the significance of that pathological process in terms of therapy and prognosis. Thank you very much.